Okay, we're here with Dr. Jeff Young.
Hi.
Dr. Young, how long have you been here?
I've been here for 4 years, 4.5 years that this facility, the Cancer Care Center of York County, has been working, but I've been in Maine for over 20 years now.
And where did you work before coming here?
I did my training in Boston at the Mass General Hospital and the Children's Hospital there. I worked in Kansas City for a few years before I found life the way it should be here in Maine.
Great. Now, we're on the radiation side of the Cancer Center?
Yes. In the total spectrum of cancer care, about 55 to 60% of patients get radiation somewhere in their treatment. It may be the primary or even only method of treatment. It may be used in conjunction with surgery and chemotherapy, as oftentimes it is nowadays. But it's a complicated technical process, but really it's all about caring for the person.
So are you going to give us a little demonstration?
Yes. Once we've had a consultation and discussed with patients the appropriateness of the radiation, how it would be done, what the potential side effects and the positive goals are, the first stage is what we call simulation or planning or mapping. And this is a modified CT scanner so that we can get a three-dimensional view of the insides of the patient. So we can create the optimum treatment plan for them, and most especially try to protect normal tissues. Say if we were treating inside this patient's lung, we'd want to protect the heart, we'd want to protect the spinal cord, but we want to give maximum dose right on that cancer. And the way we can do that is start this process. There's no touching, there's no needles now, but it gives us that three-dimensional model of the patient so we can optimize the treatment plan. And this is step one. So there's a brief time here for the patient, usually 30 or 40 minutes. They go home, and all the work behind the scenes happens between ourselves, the physicians, the therapists, the physicists, to design the optimum plan. And then they return later to our treatment machine and begin their daily treatments.
Katie, now what is your job here?
I'm a radiation therapist.
And what do you do?
I simulate patients as well as treat patients on a daily basis.
So you would set somebody up?
Yep. Basically, they lay on our table, and we use a BB system. So we put little stickers on the patient's skin, and then we use our lasers to line them up, make sure they're nice and straight. We put them through the CT scanner, and we take a CT or a picture. And then the doctor goes ahead and draws the treatment volume on, and then he shows us where to place the marks on the patient's skin. And so once that is complete, we come back out, we place the marks on the patient's skin, we use a small needle, and we tattoo the patient. It's just a very small mark, but it's optimal for their treatment so it doesn't wash off. They're able to shower every day.
We'll be right back.